It feels a bit like abandonment because to me, it's not a matter of, something trifling or trivial. It's a fundamental part of how I identify.
Years of patients flying across the country for a major surgery and even paying out of pocket for major parts of the trip. All of this the reality for trans Albertans trying to access gender reassignment surgery.
Everything is so obscure, and I find that to be the biggest challenge is just how confusing it is to navigate this system, and there isn't much support for patients.
Brett first became aware of her transness in her early 30s, starting the process for surgery around 2015. Since then, it's been an uphill battle.
I was told the next time I came into the office that the wait time was 4 years before I could see somebody. Like that to my mind is fairly atypical of what a patient trying to access a surgery would face.
Those years aren't spent just waiting around. Brett has had to go through multiple physicals, affirming she is healthy enough to undergo a surgery that still hasn't even been booked.
There's nothing in the calendar in terms of when the surgery is going to happen. So for sure there'll be physicals again in the future to affirm that I'm a candidate for surgery. But I've had 2 of them now. And still waiting for funding to be approved from Alberta Health Services.
Those seeking care also need psychiatric assessments.
You have to have a first sort of screening, and then there's a second opinion. So in the second instance, the questions were very invasive and very, pulling out a lot of private information and intimate details, and it was very uncomfortable.
And the challenges don't stop there. Alberta doesn't offer gender reassignment surgery in the province, so Brett needs to go to Montreal to finish her healthcare journey.
To me, that's just very daunting to have to, presumably, take myself and my family across the country to access a surgery that's very invasive and focused on the torso. And then to have to jump back on a 5-hour flight, within a day or 2, I assume, of that surgery to come home. I just find that really absurd.
Alberta Health Services will pay for the surgery itself and the flight, but not accommodation or food. In a statement, AHS says at this time, there are no plans to provide these surgeries in the province because of the specific expertise required. An Alberta Health Services Advisory Committee has been established and is providing input on ways to improve sexual and gender minority healthcare in our province.
But the system itself seems antiquated and just laden with barriers.
In Calgary, Joe Horwood, City News.